Welcome to my channel. In this lecture, we'll be looking at the blood supply of the uterus. I'll put up a lecture on the anatomy of the uterus. If you've not checked out that lecture, please kindly go and do so. But for this class, we would be focusing on just the blood supply of the uterus. Using this image by the side, this is where we have the uterus here, carried in green. The uterus is supplied mainly by the uterine artery. The uterus also receives contributing or supporting branches from the ovarian artery. In this lecture, we would be looking at how the uterine artery emerges, the course that it runs from where it emerges from, and also the different branches that it gives in supplying the different sub-regions of the uterus. The blood supply of the uterus is mainly by the uterine arteries. This uterine artery is a branch from the anterior trunk of the internal iliac artery. We have two uterine arteries. We have one on the right and we have the other one on the left. If you try to use this image by the side, this is where we have the internal iliac artery. We know that the internal iliac artery is one of the terminal branches of the common iliac artery. We've tried to illustrate this in our previous lecture on the common iliac artery. If you've not also checked that lecture up, please kindly go and do so. The internal iliac artery, which is one of the terminal branches of the common iliac artery, is seen to also terminate into two trunks. So we have the anterior trunk of the internal iliac artery, and we have the posterior trunk of the internal iliac artery. It is from the anterior trunk of the internal iliac artery that we have the emergence of the uterine artery. And this is how it emerges here in dotted red. So as we have this presentation on the right, we also have it also on the left. We said that the uterus also receives supporting branches from the ovarian artery. We know that the ovarian artery is a branch from the abdominal aorta, and this artery also gives branches to also support the blood supply of the uterus. We would be explaining how the branches from the ovarian artery also give contributing support to supply the uterus as we go through with this lecture. So let's look at the course that the uterine artery runs from where it emerges from. Remember, we said that the uterine artery is an emergence from the anterior trunk of the internal iliac artery. So let's also use this image by the side to illustrate the course that it runs from where it emerges from. This is where we have the internal iliac artery. This is the internal iliac artery giving off the anterior and the posterior trunks. And this is what is highlighted here in red. From this anterior trunk at the front is where we have the emergence of the uterine artery. So as it emerges from the uterine artery, you see it directed medially towards the cardinal ligament. The cardinal ligament is the inferior ligament that is located at the inferior border of the broad ligament. This is where we have the broad ligament here, where this arrow is pointing. And at the inferior margin of the broad ligament, we have the cardinal ligament that is highlighted here in purple. This cardinal ligament is seen to emerge from the lateral wall border of the cervix, and also the lateral wall border of the upper region of the vaginal canal. And you see it directed laterally, where it's finally inserted on the lateral pelvic floor. This ligament is seen to find its attachment point specifically on the ischial spine. And you see it directed and inserted at this specific region on the lateral pelvic floor. So this is how the cardinal ligament runs. This cardinal ligament can also be referred to as transverse cervical ligament. And you see it running transversely also. It can also be referred to as the Mackendron's ligament. So you see it running transversely within the pelvic cavity. Also seen at the inferior border of the broad ligaments. This is where we have the broad ligament here, carried in blue. And you see it along this course. It is crossing anteriorly to the ureter. This is where we have the ureter here, highlighted in black. Remember, we said that the uterus is sandwiched between the urinary bladder anteriorly and also the rectum posteriorly. So let's imagine that we have the urinary bladder at this front, and we know that we have the ureters emerging from the urinary bladder. So after the ureter here, highlighted in black, emerging from the urinary bladder, you see it coursing deep to the uterine artery. And this is where we have the uterine artery here, crossing anteriorly over the ureter. And this is what is projected here in this image. And along this course that it runs in relation to the ureter, you see it giving off a branch here that is highlighted in white to the ureter. And this is where it gives off an arterial branch to supply the ureter at this point. So this is the first branch that uterine artery will give from where it emerges from along the path that it runs. Then you see this uterine artery further proceeding in its journey, and this is where it is finally seen to terminate at the lateral border of the cervix. This is where we have the lateral wall of the cervix, and at this point that is carried at this point, it's specifically referred to as the cervico-uterine junction. This is the point where we have the beginning or the emergence of the cervix. Remember that the cervix is located inferiorly to the constricted region that is referred to as the isthmus. And we know that above the isthmus here, we have the body of the uterus. So at the point where we have the cervix connecting with the isthmus, which is the constricted region of the uterus, before we then have at this superior region the body, is where we have the termination here of the uterine artery into the ascending branch that is highlighted in yellow, so the descending branch here that is highlighted in blue. So you see that at this cervico-uterine junction, it is seen to finally divide into an ascending branch, just as the name implies, it's seen to ascend superiorly, and a descending branch that is seen to descend inferiorly. And if you look deep into the ascending branch of the uterine artery, you see that it is coiled. And this coiled presentation is to create the allowance for the blood supply of the uterus in its expanded stage. You know that during pregnancy, the uterus is seen to expand, and in creating the allowance to also supply the uterus at this stage is why we have this coiled presentation, the ascending branch of the uterine artery. We know that the expansion of the uterus will occur more around the superregion. And this is where it's already creating the avenue to do that in case of pregnancy. So let's drive further in highlighting the branches that will emerge from both the ascending and also the descending branches of the uterine artery. In this slide, we'll both be looking at the ascending branch. Remember, we said that the ascending branch is an emergence from the cervico-uterine junction here of the uterus, where the uterine artery, after its emergence, seems to divide into the ascending branch that is highlighted in yellow, and also the descending branch here that is highlighted in blue. For the ascending branch, you see it running along the lateral border or wall of the uterus. This is where we have the uterus here. This is the body of the uterus. This is the isthmus, and inferiorly here we have the cervix. We say that at this point, the cervico-uterine junction is where the uterine artery will divide, and this is where we have the emergence of the ascending branch of the uterine artery. This ascending branch is seen to be located within the broad ligament of the uterus. This is where we have the broad ligament of the uterus here, carried in blue. We already described in our previous lecture on the broad ligament of the uterus, how we have the emergence of the broad ligament. This is where we have the emergence of the broad ligament at the lateral border of the uterus. And you see the ascending branch of the uterine artery patterned within the broad ligament. So if you try to imagine this ascending branch of the uterine artery that is highlighted here in yellow, patterned in between this broad ligament, it is not placed as it is seen here in this image. So you can imagine this ascending branch patterned within the two layers of the broad ligament at the lateral border of the uterus. So this is how we should imagine this presentation. So you have it located within this region. And we've also tried to highlight the basis behind the coiled presentation of this ascending branch. We say that during pregnancy, the uterus is seen to expand. And because of this expansion, it means there will be the need for increase in its supply. So this coiled presentation is already creating the avenue to do this, because this means that the ascending branch of the uterine artery will be creating more space for that, so that during the state of pregnancy, uterus can have sufficient blood for itself. And we know that the expansion will occur at this upper region. And this is why we have this coiled presentation at this space. And remember, we already highlighted in our previous slide that the uterine artery, before it's dividing into the ascending and descending branches, giving off a branch to supply the ureter. And it is at this point where it is seen to pass anterior to this structure that it provides the blood supply for this structure. So upon its division into the ascending and descending branches, for the ascending branches, what is highlighted here in yellow, we say cutting in between the broad ligaments. And within this space, you see it giving off the anterior and the posterior arcuate arteries. Arcuate means it runs in an arc-like configuration. And this is where we have the emergence here. This is the anterior arcuate arteries. And we have behind, we have the posterior arcuate artery. So we can imagine this emergence at this posterior region. while these anterior aquate arteries are seen in the anterior region. So as you have this presentation on this side, we should also imagine this same configuration also on the other side. These aquate arteries will then further subdivide into branches that will further drive into the deepest layer of the uterus. We know that the uterus is made up of three distinct layers: the perimetrium, the myometrium, and also the endometrium. So these anterior and posterior aquate arteries will further divide until when they get to the terminal division or branch that will be able to reach the endometrial layer. So let's try and use this image also by the side here to illustrate this. So this is where we have the outer layer of the uterus, which is the serosal layer. This is also referred to as the perimetrium. This is where we have the aquate artery. Specifically, this is the anterior aquate artery on the right, and we have the anterior aquate artery on the left. We have a number of these arteries on one side and also on the other side. And these anterior and posterior aquate arteries at the midline are seen to form anastomosis. And this is what is projected here in this image. And if you go behind you have the posterior aquate artery on the right and the posterior aquate artery also on the left. So you see it also anastomosing around this midline region behind. So the aquate arteries are seen within the perimetrium or the serosal layer. So they are limited to just this layer of the uterus. Then you have these aquate arteries, then further dividing into the radial arteries. These radial arteries are limited within the myometrial layer. This is where we have the myometrium, which is the middle layer of the uterus. And at this region, we then have the emergence of the radial branches from the anterior and the posterior aquate arteries. And you see it emerging at right angle. So at right angle, running directly in an angle of 90 degrees, you have the emergence of the radial artery. So you have it emerging at this point here that is highlighted in yellow. You also have it emerging from the posterior aquate arteries. So this is how you have the radial artery, although now going into the second sublayer of the uterus. Remember that the aquate arteries are limited within the perimetrium, while the radial arteries are now driven into the myometrium. The next layer, which is the deepest layer, which is the endometrial layer, and this is the next division that will be entering into this subregion. So from the radial artery, we then have two divisions: the basal artery and also the spiral artery. And this deeper region here is where we have the endometrium. This endometrium is what is highlighted here in yellow. We say that in the endometrium, the radial vessel or radial branches will then be seen to further divide into the basal artery. This is the basal branch here highlighted in white, and also the spiral branch here that's highlighted here in blue. So you see these two branches driving into the endometrial layer. So you now see that the aquate branches that emerge from the ascending branch of the uterine artery is then further seen to give subdivisions that has now finally penetrated into the endometrial layer. And this is where we need these vessels to supply nutrients and also oxygen for. We know that the endometrial layer of the uterus is highly active, and this is what proliferates to receive the implants during the process of implantation. So this is what is seen here in this image. But there are differences between the basal and also the spiral artery in terms of how they are configured. If you look at the basal artery here, you see that it is straight and also short. And because of this, it is not able to get into the deepest layer of the endometrium. You know that the endometrium is further subdivided into the stratum basalis and also the stratum functionalis. The stratum basalis is what receives the basal branches because it is seen to be short and also straight. So it does not have the access to enter or penetrate into the stratum functionalis. While the spiral branch, which is longer and also coiled, is able to access the functionalis layer of the endometrium of the uterus. And this layer is also highly responsive to hormone, while the basal layer is not responsive to hormone. So these are the differences between the basal and also the spiral branches that will emerge from the radial branches. And this spiral artery, because it is long and also coiled, is also able to reach the stratum functionalis. And this is what supplies the subregion of the endometrium. So you see that we have this aquate artery at the anterior and the posterior region. Of course, our emergence from the ascending branch of the uterine artery, being now able to access the endometrial layer. And this is what is projected here in this image. You can see how interesting this is. And in trying to explain this, we've been able to illustrate it and break it down in the most simplest form. So let's further drive into the ascending branch of the uterine artery. Upon the emergence of the aquate artery, this ascending branch of the uterine artery also further proceeds in its journey. So let's see the other features that it presents along this course. So the next branch that it gives is a branch to the fundus. So you see a branch emerging at this point, directing supply to the fundus of the uterus. The fundus of the uterus is located at this superior upper margin that is located above the emergence of the uterine tube. This is where we have the emergence of the uterine tube. And at this upper region is where we have the fundus. Upon this, it then finally seen to terminate into the tubal branches and also the ovarian branches. So this is where we have the tubal branches there highlighted in white. These tubal branches are seen to supply the uterine tubes, and they are specifically seen to supply the medial two-thirds of the uterine tube. What then supplies the lateral one-third of the uterine tube? The lateral one-third of the uterine tube is supplied by branches from the ovarian artery. So this is how the uterine tube enjoy blood supply from both the uterine artery and also the ovarian artery. So after terminating, you see it first giving up tubal branches to supply the medial two-thirds of the uterine tube. Then finally it gives off the ovarian branches that is highlighted here in purple. And these ovarian branches finally will be seen to form an anastomosis with the ovarian artery. We know that the ovarian artery is a branch from the abdominal aorta. So you see the ovarian branch of the ascending branch of the uterine artery finally forming an anastomosis at this point with the ovarian artery where this arrow is pointing. So this ovarian artery, after giving off branches to supply the ovary that is highlighted here in dotted red, you see then finally forming an anastomosis also with the ovarian branches of the uterine artery. At this point here is where we have the ovarian artery also giving supporting supply to the uterus because of the anastomosis that is created here. So this is where we say that uterus is also receiving support from the ovarian artery. So it is at this point where this anastomosis is created. And we know that the ovarian artery is what supplies the lateral one-third of the uterine tube, and this is what is highlighted here at this point. So now let's look at the descending branch. Remember we said that the uterine artery at the cervicuterine junction here, we divide into the ascending and also the descending branches. We tried to highlight in our previous slide the ascending branch. For the descending branch, that is also referred to as the cervicovaginal artery, and the basis behind this name is because it gives some branches to supply the cervix, which is the inferior narrow region of the uterus, and also the vaginal canal. And this is why this name is so drafted. So this artery at this point, we give off a branch to supply the cervix at this region that is highlighted here in white. And this artery then further drives down along the lateral wall border of the vaginal canal. And this is where it gives off the vaginal branch of the uterine artery. So the vaginal branch of the uterine artery specifically from the descending branch of the uterine artery. This vaginal branch that is highlighted here in blue will finally be forming an anastomosis here at this point with the branches from the vaginal artery. So we have the vaginal artery highlighted here in black. This vaginal artery is also an emergence from the anterior trunk of the internal iliac artery. And after its emergence, you see it at this point also giving a contributory branch into the formation of the anastomosis created between its branches and also the branches from the vaginal branch of the uterine artery. It's important for us to separate the vaginal branch from the uterine artery and also the vaginal artery. We have the vaginal artery emerging on its own from the anterior trunk of the internal iliac artery, just as we have the emergence also of the uterine artery. But we have the uterine artery finally giving up the vaginal branch from its descending branch. And this is what is projected here in this image. It is important to clearly be able to differentiate this. We said that this descending branch from uterine artery that is highlighted here in dotted blue is also referred to as the cervicovaginal artery. And we now know why this is so, because the branches that emerge from this descending division give supply to the cervix and also the vaginal canal. If you go back to how it descends, you see that it gives off a branch here to the cervix that is highlighted here in white, and also the vaginal branch that finally creates an anastomosis with branches from the vaginal artery. So in summary, let's try and use this slide to capture all the different regions that the uterine artery will supply. And this should come easy. So it seems to supply the uterus, which is the sole reason why the uterine artery is created. So you see it giving off branches here, the anterior and the posterior aqueous arteries, where it is seen to further drive down into the endometrium lining of the uterus. We try to highlight how this occurs. Then it's also seen to give an emergence to the fundus. Then we have also an emergence here at this inferior region, specifically from the descending branch where it supplies the cervix. Cervix is also a sub-region of the uterus, but can also be taken as a separate structure on its own. So you see it supplying different sub-regions of the uterus, and it is also seen to provide supply also for the uterine tube. At this upper region, we say that the ascending branch of the uterine artery will terminate to supply the uterine tubes, and it is seen to specifically supply the medial two-thirds of the uterine tube. This is what is seen here to be highlighted in white. It is also seen to supply the ovary. If you look at the terminal branches of the ascending branch of the uterine artery, yes, dividing into two branches to supply the uterine tube, and also the ovarian branch to form an anastomosis with the ovarian artery. So at this region, it is also seen to give a supporting supply also to the ovary, while the ovarian artery also is giving a supporting supply also for the uterus. And it's also seen to also supply the ureter. Remember the first branch that it did from where it emerges from here, the anterior tract from the internal iliac artery. It is seen to pass anteriorly to the ureter. And at this point here, that is where this arrow is pointing, it is seen to give off a branch to supply the ureter. Then finally, it is seen to also supply the wall of the vaginal canal. At this inferior region, where the descending branch of the uterine artery further drives down along the lateral border wall of the vaginal canal, it's seen to also supply the vaginal wall at this region before it finally forms an anastomosis with branches of the vaginal artery that emerges from the anterior trunk of the internal iliac artery. So these are the different regions or organs supplied by the uterine artery. See that the uterine artery is not only seen to supply the uterus, it is also seen to give branches to supply the neighboring structure. Thanks for watching this video. Continue to stay glued to this channel.